you this baby to demonstrate another way of giving respiratory support to a preterm baby. What we demonstrate here is what is known as continuous positive airway pressure ventilation, or commonly known as Cpap. Cpap is a non-invasive way of ventilation where we do not use an endotracheal tube but connect a small machine to the baby's nostrils, which will give a continuous flow of oxygen and thereby giving an effect which will prevent the collapse of alveoli. Cpap has revolutionized the ventilation of preterm babies, and currently most babies who have mild to moderate respiratory distress because of surfactant deficient lung disease will benefit from Cpap. While the baby is on Cpap, it is still possible to feed the baby through a orogastric tube and also to give the normal other care the baby needs. Generally, babies are started on slightly higher settings, and as the respiratory distress becomes less, the amount of oxygen provided by the Cpap is gradually weaned off. The baby will also be monitored with saturations and heart rate to ensure that the amount of oxygen that is being given via Cpap is adequate for the baby to maintain normal oxygenation. This baby, who is in a warmer, has been just weaned off from the head box, and he has been downgraded to a face mask oxygen. You can see for yourself that the head box, which was used for the baby, is by the side of the baby, and the nursing staff, after moving the child from the head box to face mask oxygen, will be carefully monitoring to see whether the baby is able to maintain saturations with the support of a face mask. In terms of the oxygen concentration delivered, a head box will give higher amount of oxygen to a child as opposed to a face mask. I am about to show you another way that a baby can be given oxygen. This is what is called a head box, and you see that there is a box-like or a circular structure which is connected into oxygen tubing from an oxygen port, and a baby who needs oxygen can be given oxygen via a head box. And in a head box, while oxygen is being given, you can see that the blanket has been brought in close to the head box so that there is less amount of the oxygen being given moving out into the exterior environment. Some babies who have been started on ventilation and then subsequently weaned off to the continuous positive airway pressure ventilation, and when they are weaned off or when they are removed from continuous positive airway pressure ventilation, some of them will now be downgraded into head box oxygen. Let you and show you another baby who is being given head box oxygen, and you can see that this baby is in an open cot and again comfortably sleeping while on oxygen. A baby who is in an open cot, as I said previously, is a baby who is able to manage thermoneutrality and therefore will not be getting any support either from the machine, who will not be getting any support to maintain thermoneutrality. This is another baby who is being nursed in a warm, and why we are showing you this baby is to demonstrate to you how nasal prongs can be used to give oxygen to a baby. Here again, you can see that there is a small tube-like structure which has been inserted to the baby's nostrils, and it has been connected to an oxygen port. Nasal prongs is a very effective way of giving oxygen to a baby in respiratory distress. Because of the continuous flow of oxygen, it will give a certain amount of a Cpap effect and try to maintain the alveoli pattern without allowing it to collapse. Sometimes babies who are started on ventilation, when their respiratory functions improve, will be slowly downgraded into Cpap and then subsequently weaned off to nasal prongs. If a baby is maintaining saturations comfortably on nasal prongs, such a baby then may be considered whether he or she could be downgraded into face mask oxygen. And once they are stable on face mask oxygen, a small amount, then the staff would see whether the baby could maintain saturations while on room air.